Health professionals use various techniques in placing patients comfortably on bed, as these positions significantly affect how the patient recovers. Patient positioning is a critical clinical intervention used to improve overall body wellness, provide surgical access, and prevent serious complications like pressure ulcers or nerve damage. So what is patient positioning? It simply is a practice of arranging a patient's body in specific postures for comfort, safety, dignity, and to provide optimal medical access. Patients are positioned in 3 major styles. Some patients are placed sitting, or even standing. Others are placed in flat and horizontal positions, while some are placed in very specialized positions that are not usually as comfortable. In radiology, understanding patient positions and the reasons as to why they are used is critical because patient positions control gravity. Gravity affects how air rises, how fluid settles, and how organs shift within the body. Therefore, positioning already decides what can be seen, what can be hidden, and what can be distorted before any exposure is made. Patients in a supine position lie flat on their backs, with their face and torso facing upward. Radiologists use this position mainly for critically ill and trauma patients. This position is often chosen because it is stable, safe, and easy for the patient. Supine position reduces the effect of gravity, which can mask important findings, and this makes it less ideal for diagnostic clarity. Prone position typically involves a patient lying on their chest and belly. The head can be supported with a pillow or turned to face the sides. This stance provides unique views not possible when in a supine position. Prone reveals anatomical relationships which are hidden in the supine position because it reverses the gravity effects seen in the supine position. Prone position is used to shift organs, contrast, or gas into different relationships, and this results in higher quality of diagnosis. Sometimes patients have to stand or even sit upright. This is the erect position. This position allows gravity to act fully. Air rises, fluid settles, and organs fall into their natural positions. This position is chosen in situations when effects of gravity on the body is very important. Erect finds great application in chest and abdominal imaging, where air fluid levels need to be demonstrated. It also reveals findings that are not visible in the supine or prone positions. Simply put, if gravity matters for what you are looking for, then erect positioning matters. In the Fowler position, the patient lies on their back, with the head elevated relative to the feet. This is typically achieved by raising the head of the bed. Fowler is used when a fully erect position is not possible, but gravity still needs to be utilized. Therefore, it restores the effects of gravity, as air rises and fluid settles, although not as clearly as in a full erect position. Fowler is commonly used in patients who are weak, breathless, or unable to stand safely. It represents a balance between patient safety and diagnostic value. Just like in Fowler position, the patient lies on their back, on the bed, in the Trendelenburg position. Only this time, the feet are elevated relative to the head. This position intentionally reverses normal gravity effects. In radiology, Trendelenburg position is used to shift abdominal and pelvic structures toward the head. By reversing gravity, structures that are normally overlapped or hidden can become more visible. Trendelenburg is not routine, and must be used carefully, as it can affect breathing and circulation. It is chosen only when its benefits outweigh its risks. Recumbent positions typically involve the patient lying down. Therefore supine, prone, Fowler, and Trendelenburg are all recumbent. Sometimes the patient can lie on one side of their body. It is called lateral recumbent. In this position, gravity still acts but in a horizontal direction. This makes it ideal for demonstrating small amounts of air or fluid. Lateral recumbent position is often used in trauma, weak patients, or those unable to stand. When erect views are not possible, lateral recumbent positions act as substitutes to preserve gravity effects. Sims position is a modified side-lying position with the patient partially rotated toward the prone position. One leg is straightened, the other is slightly flexed at both the knee and hip, and then placed on a support for comfort. In radiology, SIMS positioning is used when full prone or full lateral positioning is not tolerated. This position allows partial gravitational shift of abdominal and pelvic structures while maintaining patient comfort. SIMS position is often a compromise, balancing anatomical shift with patient tolerance. It is chosen when ideal positioning is not possible, but some gravity effect is still needed. Lithotomy position involves a patient lying on their back, with hips and knees flexed, legs raised and separated in stirrups. In radiology, lithotomy positioning is primarily used for pelvic, urological and gynecological imaging and procedures. This position opens the pelvic region and changes the relationship between pelvic organs. By flexing the hips and elevating the legs, pelvic structures become more accessible and better visualized. Lithotomy positioning is chosen for access and anatomical exposure, not for gravity alone.